A very good morning to one and all. Today we are discussing about the first topic, that is deformities of external ear. Last class I had given introduction and we reviewed with anatomy and physiology. So we are moving to first topic, that is deformities of external ear. First of all, once again, I am just discussing the anatomical part of external ear. It consists of auricle, the pinna, external acoustic canal, and the tympanic membrane. So these are the three main area which comes under external ear. Let me introduce the topic. Abnormal development or deformities of the ear anatomy can cause a range of complications from cosmetic issues to hearing and development problem. So, due to the abnormal development or deformities, if it is not developed properly, or which developer is having some kind of deformities, some irregular development. So that is a one thing is abnormal development or underdevelopment. The other one is if it is not properly developed. So it can cause range of complications like cosmetic issues. So the appearance of the part and to hearing. So cosmetic means just a minor complication to hearing loss. That is a major complication. An estimated 6 to 45% of children are born with some sort of congenital ear deformity. So out of 100, we can say 6 to 45% of the children are born with congenital deformity. Some ear deformities are temporary. If the deformity was caused by abnormal positioning in the uterus or during birth, it may resolve as the child grows. So, some of the deformities are temporary. So, as we know, deformities may be temporary and permanent. In some of the ear deformity, they are temporary. If it is formed due to abnormal positioning in the uterus or during birth. So, during birth time or during the fetal life, if due to some abnormal positioning, if some deformity occur, sometimes it may resolve, or it will come to normal when the child grows. Other ear deformities will need medical intervention, either non-surgical or surgical, to correct the ear anomaly. And most of the ear abnormalities or deformities we can correct with the help of surgical or non-surgical interventions to correct the ear anomaly. So let us move to the topic, diseases of the pinna. It including congenital, traumatic, and inflammatory. Congenital means by birth. Traumatic means due to any trauma or injury. Or inflammatory means due to some inflammatory conditions. Let us see what are the congenital anomalies. First one is anochia, microtia, macrotia, then accessory auricles, preauricular sinuses, Darwin's tubercles, Wildermuth's ear, then ear canal stenosis, oral atresia, ossicular deformities, and mandibulofacial dystosis. So these are the common ear deformities. We will discuss one by one. Let us start with Anochia. Anochia, a rare congenital deformity, involves complete absence of auricle or pinna. So Anochia is a rare congenital deformity which involves complete absence of auricle or pinna. So I will show the picture. So here the absence of pinna, the complete absence of pinna, you can, or some absence of pinna we can see in the Anochia. It causes are defect in gene or taking isotretinoin during pregnancy. Say radioisotope. So while taking isotretinoin or defect in gene can lead to anochia. Treatment is cosmetic reconstruction of the external ear, normal shape and repair of ear canal. So cosmetic reconstruction is available to or to resolve the anatomical deformity. So this is a picture. Then next we will move to another one, that is microtia. It is a congenital ear deformity marked by excessive growth of ear. So microtia means anochia is the absence, and microtia is a congenital ear deformity marked by excessive growth of ear. Ear, the size of the ear is increased. Causes are inherited genetic disorder, and the treatment is autoplasty or repair of the ear is performed to reduce the size. So you can see the picture, the size is increased, okay, than the normal size. The next one is polyochia. Polyochia. In polyochia, otherwise we can call it as accessory auricles. Means poly means more than more than two or more than one ear. So polyochia is extreme rare congenital anomaly. It is defined as an accessory ear that is large enough to resemble an additional pinna. So additional pinna is forming accessory. You can see in that some accessory ears you can see on the picture. Okay, so that is called polyochia, more than one ear. Treatment is surgical excision. So here we have to go for the removal of the excessive pinna. Then next one, this is also a kind of polyochia. Then next one is preauricular sinus. It is also known as congenital auricular fistula or preordicular cyst. So there is a sinus or an opening is occurring on the auricle region or the pinna region. It is a common birth defect marked by nodule dimple located adjacent to the external ear. So it is mainly occurring due to a nodule formation located adjacent to the external ear. Treatment are systemic antibiotics for infection and surgery to remove sinus. So if it is inflamed, then we have to go for systemic antibiotics to control the infection, and we can remove the sinus with the help of surgery. So you can see in the picture, there is a sinus formation is seen on the picture in the side of the ear, pinna. So that is called preauricular sinus. Next we will go to the Darwin's tubercle. That is another condition. It is a congenital ear condition often present as a thickening on the helix of the ear at the junction of the upper and middle thirds. So helix, that is the upper part of the pinna. So helix of the ear is getting thickened. There is thickening is occurring on the helix region. It is already a soft part. So if it is getting thickened, that condition we can call it as Darwin's tubercle. It is also a congenital ear condition. Then Wildermuth's ear. Wildermuth's ear. That is a congenital anomaly. Helix is turned backward and the anthelix is prominent. So helix. So you have to review the anatomy and anatomical area of the ear, especially the pinna. It's very important. Then only you can easily understand what is helix and what is anthelix. Okay. So here in the picture I will show the helix region and is getting what is happening in the helix region. The helix region is turned backward. So that fold is turning backward. We are having a forward, and in this condition it is turned backward, and anthelix is prominent. The anthelix, that is the inner part, is prominent. The treatment is otoplasty or repairing of the ear. Then next we can see ear canal stenosis. Stenosis already you have studied in the second year. It is called narrowing. So narrowing of ear canal develops when ear canal fails to develop during 7th month in uterus. So it is a developmental disorder. So during the 7th month of uterine life, if the ear canal fails to develop properly, that can lead to ear canal stenosis. It is repaired by widening the canal by canal plasty. Okay, canal plasty is a surgery which we are using for widening the ear canal. Then see here you can see in the picture. The next one is oral atresia. Oral atresia means absence or incomplete formation of an external ear canal. So in that people, you can see in that there is an absence of ear canal. You can't see any opening into the ear. Okay, so that is called oral atresia. Then next is traumatic. Next we will be discussing about the traumatic ear deformities. In that first one is laceration. It should be repaired as early as possible. Perichondrium is stitched with absorbable sutures. So laceration, that also we already studied in the second year. It is a kind of injury. It is a kind of sharp injury, that is called laceration, which is occurring as a result of some accident or some kind of trauma. So it can be easily repaired, and with the help of stitching the perichondrium together with the help of absorbable sutures. Next one is avulsion of pinna. Avulsion of pinna means here the pinna is still attached to the head by a small pedicule of skin. There is a small pedicule of skin you can see in the pinna, that is called avulsion of pinna. Normally, primary detachment is considered. Completely avulsed pinna should be re-implanted by microvascular technique. So here the pinna is getting sticked with the, it is attaching to the head by a small pedicle of skin. Because of a growth of the skin, the pinna is attached to the head. So that is also a it is also happening because of the trauma. Then frostbite. It is occurring due to frostbite. So, when the person is exposed to cold, that time it is happening. Erythema and edema, bullae formation, necrosis of skin, etc. will occur. And treatment is rewarming the moist cotton pledges at 38 to 42 degrees Celsius. With the help of rewarming, you can treat the frostbite. The next one is keloid of auricle. Keloid means there is a this is mainly occurring due to following by a trauma or piercing of ear for ornaments. When you are doing the piercing, or when you are pierce the ear pinna for ornament purpose, or sometimes if there is a trauma is occurring, so that time some skin growth will be occurring on the area that we can call keloids. So you have studied in the last year in dermatology about the keloids. Its usual sites are lobule or helix. It may be present on the helix or the larger portion, or on the lobules on the lower portion. The next one is inflammatory conditions including perichondritis, relapsing polychondritis, then chondro, dermatitis, nodularis, chronica, helicase. Okay, so these are the three inflammatory conditions of external ear. Let us see one by one. Perichondritis pinna. It is an inflammation of perichondrium with pus between perichondrium and cartilage. So between the perichondrium and cartilage, you can see pus formation. So it is an inflammatory ear disorder. Main causes are Pseudomonas, Staphylococcus aureus, infection and secondary infections from other ear pathologies. The main cause for this condition is Pseudomonas and Staphylococcus aureus, and sometimes it can occur due to secondary infection of the ear canal. Okay. Then the signs and symptoms including burning sensation of ear, painful movement of the ear, then fever, body ache, and pinna, you can see totally it is deformed, like a cauliflower shape will be there in the pinna. So that is a characteristic of perichondritis pinna. Then the treatment of perichondritis are, first of all, antibiotic therapy will be there. Based on the clinical signs and symptoms, we have to provide antibiotic therapy. Then local 4% aluminum acetate application. Directly you can apply 4% aluminum acetate. It will help to free from the pus and microorganisms. Then incision and drainage is there. Incision of drainage too, and multiple opening, pressure bandaging. Okay, these are the management for perichondritis condition. The next one is relapsing perichondritis. It is a rare autoimmune disorder involving cartilage of the ear. So it is present in the cartilage of the ear, and is a rare autoimmune disorder because of the malfunction of our body cells. The external ear becomes stenotic. So here what is happening means the external part of the ear become narrowed, and treatment is high dose of systemic steroids. With the help of systemic steroids, we can treat this condition. Then next one is Chondro, dermatitis, nodularis, chronica, helicase. So that is another condition, inflammatory condition of the external ear. It is a painful and tender nodules appear near the free border of helix. So the border of the helix, or the outer portion of the helix, you can see a small tender nodules. Okay, painful tender nodules will be appearing. So that we can call it as chondro, dermatitis, nodularis. Patient unable to sleep on the affected side. Main problem is the patient can't able to take sleep with the affected side. Is mainly seen in men about age of 50 years, and the treatment is excision of nodules with its skin and cartilage. So only one treatment is available, that is a surgical management. We have to excise the nodules or remove the nodules with its skin and cartilage. So that is a treatment for chondro, dermatitis, nodularis. The next one is hematoma of the auricle. So that is comes under traumatic injury. Collection of blood between the auricular cartilage and its perichondrium. So due to any trauma or anything, if the blood is collecting inside the auricular cartilage and perichondrium, that we can call it as hematoma of the auricle. Extravasated blood may clot and then organize, resulting in a typical form deformity called cauliflower ear. So this also we can call it as cauliflower ear, because you can see in that the clotted or the collected blood is forming as a clot inside the auricle or in between the auricle, and there is an appearance of cauliflower formation. So we can call it as cauliflower ear. Treatment is aspiration of the hematoma and carefully packing all concavities. Okay. So one of the treatment for this condition is we have to aspirate the blood clot from the particular nodules, and we have to pack the cavities or the area from where you have aspirate the blood. Okay. So this all about the topic deformities of the ear. So we have discussed about congenital deformities, then traumatic deformities, and inflammatory deformities. So all of you go through the topic. If you have any doubts, you can feel to contact me. I hope all of you understood the topic. Thank you. Have a nice day.